Careless littering and handling of COVID-19 medical waste and other forms of waste poses high risk of infection. Improper disposal, such as open-air burning, is both risky and also pollutes the environment. Such waste must be collected, treated, and disposed of properly to mitigate any adverse impacts on humans and animals, as well as the ecosystems and biodiversity of the environment. The Ministry, in conjunction with county health officials, has been working to ensure the regular disinfection and cleaning of public places is carried out. Going now to our COVID statistics. Today, 605 people have tested positive after sampling 4,547 samples over the past 24 hours. The number of COVID positive in the country now moves to 23,202. And the number of cumulative tests that we have conducted in the country is now 322,923. Amongst these 605 positives being reported today, 582 are Kenyans, and the remaining 27 are foreigners who are residents in this country. 401 are males, 204 are females. The youngest is a 2-month-old infant, the oldest is 99. The distribution of cases by counties in descending order is as follows: Nairobi 373, Kiambu 35, Migori 25, Busia 20, Narok 20, Kajiado 16, Laikipia 16, Nakuru 15, Kakamega 12, Uasin Gishu 11, Machakos 10, Mombasa 9, Samburu 8, Turkana 7, Oranga 5, Kericho 5, Taita Taveta 3, Nyeri, Makueni, Kisumu, Kilifi, Elgeyo Marakwet 2 each, Siaya, Meru, Kitui, Isiolo, and Bungoma 1 each. I will run down the distribution of these cases according to sub-counties for Nairobi and Kiambu. The cases in Nairobi, 373 cases, are from Langata, 79, Dagoretti, 36, Embakasi, 35, Westlands, 31, Embakasi South, 22, Kampunji, 20, Embakasi West, 19, Kibra, 19, Dagoretti South, 18, Kasarani, 16, Makadara, 16, Waraka, 13, Roysambu, 11, Mathare, 10, Starehe, 10, Embakasi Central, 9, Embakasi North, 9. In Kiambu, we had 35 cases, 12 of these from Kiamba, 6 from Kikuyu, 5 from Kabete, 3 from Lari, 2 from Juja, 2 from Luiru, 2 from Kiambu Town, 1 from Gatundu North, 1 from Limuru, and 1 from Thika. I will also give you a breakdown of the 25 cases in Migori. These are in Suna East, 11, Kuria West, 9, Awendo, 3, and Ururi, 2. While in Busia, the 20 cases are in Teso, North, 15, and Matayos, 5. The rest of the distribution is in the document and the pressure that will be distributed to you. Today, it's a delight for us to inform you that 587 patients have recovered from the disease. From this number, 500 are from the home-based care program, while 87 have been discharged from various hospitals. And This brings the number of recoveries so far to 9,327. Once again, we congratulate our healthcare workers for the commendable work they're doing in managing this disease. Sadly also, I want to let you know that 6 patients have succumbed to the disease, bringing our total fatality to 388. We convey our sincere condolences to the families and friends of those who have lost their loved ones.
Considering that 70% of our cases are in Nairobi or thereabout, as a ministry we have intensified, of course, contact tracing in Nairobi to identify these vulnerable groups. And part of this includes identifying first the primary cases or the index cases, so that these are either then put on the home-based care or put in isolation if they have symptoms. And important is home-based care is a NAP-based follow-up, where you see that there are no contacts that are made. We are encouraging healthcare workers who are following up clients on home-based care to introduce them to the Tenge app, so that by the time the contact tracer reaches out to the primary case or the contacts, putting them on home-based care, then they are introduced and asked to log into the Tenge app, and they are able then to self-report their follow-up symptoms and how they feel. That goes directly to our electronic medical records, and we are able to see this in our emergency operation center. So, out of the counties that are also in this, also following up their clients through the different counties, we have a reporting system that then reports back to our public health emergency operation center. At the time of coming to press, we had 23 counties reporting, and the total number in home-based care currently is about 1,052 that have been follow up this as of time of coming to press. So we are encouraging those who may feel that the calls are not made to also familiarize yourself with the Tenge app, and as a minister, of course, we'll be rolling out more training on healthcare workers and to the general public, because home-based care is also going to involve family members, not just healthcare workers. So we're going to involve the entire public, and we'll be working together with the communication teams so that we roll out this system of home-based care to the entire public so that we are all familiar. And I think there's a new publication of a very user-friendly home-based care protocols. I think that has been rolled out as late as last week. It is pictorial, and everyone in the, even if you're not a healthcare worker, you're able to follow through the guidelines given on home-based care, so that we can provide this home-based care not by healthcare workers alone, but also by relatives who are at home, provided they get adequate and appropriate personal protective equipment. Maybe one more issue on testing, sir, and the question was, who are we testing? Yes, and I will say there again, there's a lot of panic in the general public, and everybody wants a test. And the value of testing, someone is asking. Again, we have rolled out our testing strategy. I think it's available in our website, and it's for you to can peruse and see the value of that testing, who are we testing, and why we are testing. And basically, the targeted testing is not going out to the public and testing the mass testing that we've been doing. It will tell you that our priority mainly is the patient who presents with symptoms, so that we're able to manage that patient appropriately, having known the appropriate diagnosis. So you can familiarize with the testing strategy, so the question on who and why will be better explained to you if you go through the strategy.